I'm going to be sharing with individuals at this conference this field of psychocardiology, the relationship between the brain and mental illness and heart disease. And psychocardiology is a field where there are research papers and textbooks. There's lots of information. What I'll be sharing with it is somewhat a unique, uncommon discussion about some of our traditional treatments for heart disease, particularly lowering cholesterol, actually contributes to depression and suicide risk. The focus of my presentation will be understanding the dangerous effects of lowering cholesterol for psychiatric illness, particularly depression and suicide. I think most individuals, traditional physicians, as well as integrative physicians, are not aware of the dangers of low cholesterol, the dramatic increased risk of suicide and heart disease is kind of contradictory. I think one of the areas when we talk about low cholesterol that people assume that it's usually dietary or diet intake, but it appears to be genetic differences in how we metabolize and absorb cholesterol. So dietary intake, whether someone's eating steak, junk food, and has a lot of cholesterol, is not necessarily related to those that have what we call very low cholesterol. I think with the increased rates of depression in the US and worldwide, and the dramatic increased rates of suicide, I hope clinicians will begin to understand that very low cholesterol is a risk factor. The research has been documented for 30 years, and if clinicians can begin to understand and not just assume what our traditional cardiologists do, the lower cholesterol, the better. There's a dramatic scientific relationship between low cholesterol and depression and suicide. I think the field of psychocardiology, if you will, the relationship between the heart and the brain is so important and reflects so much of how we understand integrative medicine.